Debbie. Tiebe and come in be some say Moyana
It was your for your Mamunina Aquaba Eba Muya show live on OK 101.7 FM.
Moyana Musica sent to say my girl to say
Meeting the Abigail Ashley, being produced by Sammy Otavio, executive producer Dr. Father Dexter. Namuhoye Anna.
No sorry,
Mejidi sell sorry and wadanyamiase. The bia me catch us no bia na de pachino. And tis at the pacho pe. Who said ye was so yan so bedanyamiase say rade. Medase.
Bills any utility.
Simabako me pacho unye ya me kao. Yenina yenyembum. Irade. Yedase.
Music as a muso to say. Why are Sabia for check up? Get say one play will break up. Bemana will still with time.
When ya shake crack, I say, oh, me free. Obits ya. And sana home ya, oh, me free no. Nipana home. So wunima me catch you. Eya, and kayen bot na me bo. Wunima me catch you. Obits yaka. Answer. Whom ya, oh, ni free no. Or no, wait to me home. Johnson no crowd, Johnson free no. When them didn't say the beer kidney for an air contour or dialysis and so on. Or more moon to me, Johnson said I would to me Johnson. Johnson emba cry. Emba. Just say, I want to put on Marco Johnson. And so when your Johnson now would Johnson free. Danyamias why? Danyamias so big yaka. Obtia dialysis or pay. And sana Nipana Johnson. And see when ya shake cry. Odin said the open sanka inti when ya share. Kaisa humie and no Johnson now would Johnson free no. Obiti awka. Me mamunyi na akwa biom eba mo ye show with Abigail Ashley and that table no so I am mapa papa na mpese ye ebekasa afa asthma ho misa na no be frame me o say Abigail unim se onu aba mai okoni honeymoon na doctor yakọ diagnosing no say wa asthma na me say asthma then am dream say ye the wo na no crap ye say unyi a if you like a call and the other thing obi a wenyi 27 years wa it is a wako school area wa recra okọ honeymoon afi na ono ne asthma aba na me se menti ase and then one of the questions I'll be asking doctor I don't know yetuminya obi tuminya asthma ebra wenyi area na ehun hia me pa na mo nya bi de so we are looking about how to manage it say ba obey den and na omo nim hwe so emfa asthma hono ye bebisa say den potsepa and it is asthma eba and one say you say nkofo kita dey be first na me face flex na mo mi e be ash anono ash and wine bi was ash and cream color bi na mo twetwe go na me face flex but sana say your mudro ye bebisa sa na man nyina e wo show no so nti doctor dey wabet na the dada Dr. Kumi Yeboah Prince or a medical officer or bet na the dada about before 2 no kra ono de had a dada na mom ye be call line so there's an upcoming event be eba nti ye ne sister bi be bon komotew just about 10 minutes ye wia na ye ne doctor atwa so but before then and then me who the new spectator no was a spectator na about weekend and then me who ye ma shime o ye ma shime amenya ye say am see poor nutrition is the leading cause of diseases and death globally and especially in our country called Ghana. And me so me bu redeem and I mean who say Professor and Latte or your former director nutrition director of nutrition our food and agriculture organization FAO United Nations for our room on anoye in charge our no and obekasa our University of Ghana and odi sa research e na che say ade a omhwehwe mu ache ntina we ya but see in Ghana we are not eating well she say she emphasized nti dia hye columns sa won say we can be na ya wide the column ha e dia hye column no say she emphasized in Ghana we are not eating well and our diets has now become a source of disease and death for us. And I'm saying, me kind we, you know, me ma sheme pa, me nim how I was so befano, but me kind we, you know, me ma sheme, me ma sheme. Say me didi am dream say, me didi ama like manya no. You see, most of our food we are eating no, are not nutritious. They are causing death and diseases instead of keeping us alive and healthy. Inti asam no me ma shame pa.
Mumpe my girl to say Mohoye, I'm not paying Mohoye, my city name Mohoye, every day Mohoye, a quine swear, and you ray Mohoye, a yeah, what that time day, Mohoye, no sorry, Mohoye, it's your memory.
The same spectator no far and yes or can asa the benefits of watermelon. When we say fruits no eba in seasons, every season be advice say ba usu dibi. Men train manenko manebonya den and san waka say o me pese me dibi. Nyaminyan nsem wa hihye bibia ban. Obi pe ba o ndi pe ni bi. Pe ko wi afa na okwa pepe na akoto pe ba ko 30 Ghana aden me nya ho. Ade ba for 5 cedi won to bi. Betcha manako sounds na mango ba omunto mango akesi 5 cd mensa 10 cds omunto ometchen sa ekowia afi no okwa kopato ntimpamcho watermelon is in season now, and whilst it's in season it's very juicy, very red, very sweet, and to connect to bito spectator numa you read all about the benefits of watermelon to our health ewomu. So you can just go get some and enjoy. And I know crab wow a boost nutritional level na yes say you know inti u tell the dear and also wow. So enjoy your watermelons. Just make sure that you are eating a lot of nutritional food that will benefit the body, food that will not cause diseases nor death to the body. As I say, sana ya catching you see the na yidi no my a b indidi yi a ma yare ene owo nti nya yen hwe ne yi ne indidi yi police am patrol line also. Okay, line doing 1 or 2. Hello. Hi Madam Deborah.
Abigail.
Me patrol bibia boko je.
Nyame adom boko oswe.
Adom. We understand the event is in September. Then the Kaibo any preparations are here. Nti I was say ebo ho nkomo. And I was saying, okay. And see, can you just give us an update so far, the preparation so far towards the Triumph Women's Award 2025? Yeah.
Me da se ni etiefo nyina mo bo ejuma nkasa okay FM4 nyankopon hira mo na ejuma den amoye Triumph Women Awards into no way be second edition ye
okay
ye be no La Palm Royal Beach Hotel mo no me official venue sponsor
okay
na ye be ye jumedie no on the 28th of September. Na obi beka sa awards be wo kromi ntade ne yasade Triumph Women Awards aba wo share me ankasa Debbie Queen baby am free and baby am abedri nyama meyen it's all about women empowerment any mba omo bom ho modern obi ti sa Abigail wo say baby a we free any wo sorry any nyama wa famous sana wa babedu ho no wasa nyama bebree mu nti obi be say wedding kunim in Triumph no oka nominees no ho but Gente prior the Triumph Women Award by any say a bebo in bar or muya the omuya behind the scenes na abaso na in conform almost so omwe dim wo Ghana ha omuya die na so far preparations no kosi ye pa Ghana sponsors no bebre asoye mu na ye hope say in conform ebeba that day no nkukundoma ya from on baba that day na ba beta yi tuna dwumedi ayehwe na yetumi ahwe mba edin enionyam nti no wo frame mabohu tefa ama.
Okay, so this is the second year running.
Yes.
Okay, so we will start say what will be the difference last year compared to this year? What have you added? What have you deleted? What are you multiplying?
Okay. Me da se pa into the last year ye honorary Emma in bar 10. And na ye di pa the medie ne huntuma. But this year, now, because 20 categories, now, you see what. Yedi bought in bar or more idea different fields. Into crowd who say you were woman of the year, and not Edimuka, you were CEO of the year, you were entrepreneur of the year, you were most promising icon, you were social impact, and you were philanthropic icon of the year. You were like categories no quite social media.
Last year 10, but this year 20.
This year 20.
Okay.
Yeah, dear, see how yeah, baby. I'm not in bar. Now, the way na Casano, dear money demono crown, the idea can't say. A surprise, but since was criminal, my main can't say, aside in by yeah, bomb, home modelo, yeah, a normal, that day, yeah, Bema or bar or Timum pa. What she who are soon who is your say or Brian Mangana cash prize that instant.
Wow. So it's not just an award, it's coming with cash prize.
Aha.
Okay.
Yeah,
that's interesting.
Never be bra, yeah, into my they are so abundant abra September. But you know, or be all following a social media page now behold the difference in our award. Yeah, the need to say wow. Baby, now I nominate you. Now we now award maybe crowd so I be mau honorary Senate team.
Oh, okay.
Would the best talent who say at least when you are nominated.
You were nominated.
And mau say say
you are part of it, yeah.
Yeah, sure. Oh, boy, yeah, and then I win ya the flag, but at least the official pin would be.
Oh, okay. That's fair.
Thank you.
That's fair. Debbie, minimum say it's in September, so we'll be talking. Yeah, and as time goes on, we're shipping one till September day Nankasa, and then we'll talk more about it. And see, my friend at the end here, and then let's keep them in suspense.
Let's
keep our viewers and listeners in suspense till the D-Day. Okay. Now, go for your bedroom answer. So far, okay.
My stomach maybe a middle, my sister, and can la palm royal bishop. Solomon, a venue sponsor, say I'm Mr. Kai, you know. Okay, from the day I'm a babu, so I'm moving our way too. I am Bell Aqua, a beverage, official beverage and mineral. Incorporated na so ya Zoom live na ewo mu ye wo Savvy Mami Coaster body by Blondie means me bom na Dino phone na ye do mas any me team members no omo nka ho a enye me do bibia o support me now when say me godfather Abigail say or also ho pa on get behind the scenes na na madam ati so ama why
all right that means here dey na dey be here. We keep our viewers and listeners in suspense. All right, thank you.
Bye.
It was our first live on OK101.7 FM. And Maxima Kachamo say Baba Kasa Afa Asthma. And Dr. Tinasa the dad and Mamiko Studio B. Nayan Kostati and Komo Bono. Dr. Kumi Yeboah, Prince or a medical officer. He used to work with Achimota Hospital. Then he moved to the police hospital, if I'm right. And then he's now a flyaway doctor. Okoba. Doctor of fly baby, flyaway doctor. Akoshe UK. And Odini Jimmy Dienu. UK is the doctor, Ghana doctors, no call their pomope. And see, dog, Yema Aquaba. Bibi Aboko, dear.
Bibi Aboko,
Adum. And thanks for coming very early. Me won say mumu kro mumu fa time in diagro nti ye frem wo ba bia sa time na e na mudi hu djuma e maye nti ye da ase okay doc na bibisa o asthma eden na cause sa asthma no
sister be there before say me sha ase me onkofo bia mpeza me chi om kakra
okay
me pesa me chi am papa a oye osie wo hi o sanso ye achimo nchin that's a bread doctor so me do appear.
Okay.
And I think me I'm a spiritual father or no so a medical doctor to say me
sir
Pastor Dr. Daniel.
Oh okay.
And I think me I'm new penny or no na fact motors any dia e wo ma 7 Achimota side.
Oh okay.
I friend Felix Kumi. Edi ankasa nso di nanado.
Oh, okay.
And
they teach you money na baby o mu bia.
Okay. So ya ka say asthma ni twi din no ntehyewa. Sa na ye frɛ no na yare bi a affect and I say ha tubes bi a connect mframa na ye home wa bonten no edi begu de frɛ no ya hrawa ni ma ye frɛ no lungs ni. Nti asthma no de ye ne say affect sa tubes no. Na say na ye ma tubes ni mu ye ketwa say na Nyankopɔn bɔ na say mu bie nanka mframa ti mi fam lungs ni na say pia bonten kɔ no. Asthma no ma tubes ni mu ye ketwa na afei nso asama ahohoro anase mucus the obroni friend mucus no ejina sa tubes ni nti just imagine say ahohoro na
ye fan say pipe tube no bi
yes pipe tube no bi
na asem popo bibiri akata so na asthma
sa ahohoro na ya flames no ejina sa tubes ni
na efin fan ko jirim
nti de banie asthma no ye types e wo ho ye wo de friend no types no ya chichem based on the ekofa and I say the trigger asthma edeneba nti ye wo types based on triggers and your types also based on severities senior asthma no ano odin and ye wo other forms of asthma and so other variants of asthma and so na ye fa the based on severity now your dear friend no mild intermittent asthma na eno no say na tie enipa no ho a onya symptoms no within a week no bon say obenya asthma symptoms ne be once per and your dear friend no mild persistent asthma within 2 days no bon say enipa na nya within a week no obenya symptoms ne be mienu bi pe and your dear friend no moderate persistent asthma enipa nya within a week otiminya symptoms ne be 5 to 6 times afei nso na ho odin ba form eno ma bi otimi ye kra na afei ontimi nya biem na nti bi ontimi nya and your severe one no na eno de ba enipa na je se edu asthma duro bi no wa ode ma no ofia e be aje se ye na ba hospital ebi mpo aje se ya admit you more intensive care unit. And your asthma also based on the triggers ni eno na triggers no ubenya de friend no allergic asthma and I say atopic asthma ni din fufuro no na eno say na ba eno na wo de friend no genetic predisposition akwa ese nkofo bi wo ha omo genes no omo wo eno ma bi wo genes ni ma sa genes na e form ma ubenya tubes no omo tubes ni ye in such a way say ade bi a ebia e wo fi a anka obia ehua bia na se obia eba in contact with her enye ne hwe no se nipa ne ko aben saade na saade ni timi trigger the friend inflammation na ekuro kakra ewo sa tubes nim na sa ekuro ni si na se inflammation ni si a na afi ama nipa ni e produce ahohoro ni bebre na afi bonsa ahohoro na start e block tubes no te block tubes ni sa na afi honhomye ebeye den eno ne friend atopic nti eno no ewo genetic factors nti eno na se wunua bi nya bi a nso betimi anya bi nti enya asma bia no bi nya running through abusuan no ana sa ankofo no nso no omo sa other genetic sa atopic for no omo sa other genetic problems and omo sa nso other problems associated with genes ebi bi te say eczema ekro omo obi te say hay fever ana afi other type where your friend no non-allergic nti ya allergic na wi na topic de ni wo non-allergic no e de omo de na nya say genes bi na e problem their genes are okay but omo tubes ni e so sensitive to the extent that omo ben bibi to say perfumes gas ebia oye exercise kakra bi a ubon say the tubes ni emu start chi emu start tokro na enam tubes ni mbo say emu start mia yes nti humie ni ye den ma no nti ubon say wo na wo any normal person bi abetimi aben perfume ni nya ne hwe no say nipa no ben perfume a it will trigger a reaction in the airways, no, and our tubes now, a gym from a bontin to the lungs, you know, especially airways near Chemumi, your upper and your lower. Asthma affected the lower airways. Into bones say, lower airways nimu and narrow, and memu ye fia into and from mana air by inside, no, a sort of kakra, but problem nankasa in jina, the APR bonteno, because Yanko Ponce no boy a home, no, say, ye and whom inside, ye taking oxygen now, your friend active movement. You use active movement. We use a lot of muscles. You use muscles away your body, muscles away your chest and your rawan so and a bois a man any the on a difference and since you can wo your chest in him any from any wabont and let me boama and from a movie into our chest. Anna, but ye from a PADR and we a passive movement and one okay in young wording be into you be asthma because because the echo inside no and no body muscles ne normally bet me aboa mo akọ inside no and no share anya problem but the APR bontin aba no and a problem tin from a gina o lungs nim and from an intimi APR bontin na say APR bontin a the air ban foforo be den so asa ba be nti e mo bre
and
yes
I say
yes ye be ba so ne symptoms of asthma no nti you say yaka allergic and yaba non allergic ones no and you hold your friend occupational asthma you go bi o ha omo ko adwuma mu no omo ye exposed to gases and other chemicals omo ye adwuma mu to do adwuma mu nko ana a trigger sa symptoms no
I just no nya asthma no won adwuma mu
because
bibi wo adwuma mu ho a e ma sa asthma ne ba
yes
wow
triggers no adwuma mu to free adwuma mu ho a a free ho and you your friend exercise induced asthma omo yonkofo bi won so a omo exercise ya ono munya sa triggers no ono enye se ne genes bi na problem and enye ono enye se irritant bi no waben and say perfume bi no waben but so exercise ya and man ba because o exercise ya uhia a lot of air uhia from ma be brain na say from na ekọ no eya na from na no unyu kakra nti raw system ni musa na inflammatory tries a between heat every system in him. It's a twist heat in the full system in man. Now reactions now start a complex reaction kakra start see. Now face our normal way now start seeing kakra crap. And also and you what other types be to say you free baby childhood asthma. Asthma started from collaborate. Na collaborate there no ebi mu percentage of enkofo bi wo ha omo die no omunyi no esu etimi jai asthma na etimi ko ebi mu so die etimi continue from collaborate ma na asan de anyia de aba empani so and ye wo adulthood asthma sa asthma ne die no start
oh ye wo empani for the adults there
yes enipa na nyia wie and starting no die ya na ne ko odin and we ya na very severe because usually in kolane de na ya na genetics nti ye hu ni ntem a itimi start say ye managing nkakra itimi so anu nkakra sa ye hu ni ntem ba e ya mpani ni de na ya na anu so eden because sometimes where the impose nipa be hu trigger no ade ko na e ko fa sa narrowing na say tubes na emu emia no e de ba nti we ni forms of asthma ye wo nti asthma no nyina le tofa na say no krakra nyina ne say yare bi a affect your tubes no a gym from abonten into our lungs and I say ya hrawa no na say na tie ye brofocasem no your friend say a chronic reversible disease the nti ya ka say chronic ne say etena ye ho afebo unya wanya na afebo ye niki obia for it ye niki obia for asthma ye betimi an say ye betimi ama Oduro manage ama asthma nako ana reversible because and yes say e ma asthma ni jai but say attacks ne ba ne ye ma Oduro a itimi ma attack ne ko but enu nchire say asthma no every also nti ye wo ya refufuro bi anu so behave to say asthma pepepe I friend is COPD chronic obstructive pulmonary disease and asthma ne say pepepe
benya asthma
yes enya asthma but the difference ne say COPD no ɛno deɛ oma no aduro mpa ebetumi abie ne tubes ni ma intimi reverse no nti ɛno yɛ chronic irreversible nti ɛno the difference between COPD no ne asthma no nti asthma no deɛ triggers ni bi na mabobachi on ebi yɛ genetics ɛno ane atopic one no nti yɛbɛkɔ so ne yɛahwɛ symptoms na
ediba ebusiafo sese afena we do a video na to OK 101.7 FM kai say mo ho ye show and ye kasafa asthma ho na ye ne Dr. Kumi Yeboah Prince or medical officer and ye ne bon komo no wa cheche mu the types of asthma ye wo me yam crash me na me dream say ye de wo basana bebre wo ho occupational asthma yi and let's say they obia benyebi. And obia. Now who is at risk? I just want to find out who is at risk of having
nyina at risk, but issue only say ye tubes no. Ye nyina do nyankopon bo tubes no using the same normal no the bo tubes no. But ye nyina your system react to normal bebre differently. Say see obi ba say no use and I say ultimate koto semana. Ultimate koto semana be use bon say semana no krampo na angel. Ultimate koto nku be use but mo the same skin. San ye tubes no so tie. E the same tube serve the same function but obia de ensunsu ye kakra wom. Ti obi de very sensitive to ebia sa no ma ye wo adwuma ma bia perfume bi wa and I say bia ye the paint bi kura painti and I say bibi sa nto badwuma ma bia onya attack. Inti sa attack no de kofa aba ne say onya te
Scent na
then unse scent no so hwia ko mu to hwia ko mu na e fa tubes ni ma na trigger the friend inflammatory reaction the trigger reaction na fe inflammatory reaction na start in ma tubes ni mu emia eno no
say on person be real body ni mu it's not as a protective body no
akwa say wa kasa immune system try say obe fight sa ade na aba be wura mu no in the way no try so be fight no o ma tubes no emu mia aye friend no bronchoconstriction san your friend no e ma tubes ni mu mia na afi nso u tubes ni mu nso wo cells bi o ma eno le produce aworo nti no be etimi hwendro aworo ne hwendro na ya na difference no we kakra de free hwen ba no eno ne hwendro ha
na we ni free
amamai ni free enu mu ba okay nti hwendro no cells bi o ma nyankopon boy say produce hwendro mai so that ye home kra na efi wo ma e be chi fi no na de aba abonten but unya saa de ko we ni ko mu a say bi a ade bi irritate ewura mu na say ewura tubes ni ma de na say esa ma saa cells ni produce hwendro no more inti wa inflammation no anase ekuro ama tube ni mu amia tube ni nso anase pipe no nso a eno nso a wasa produce hwendro bebre tize inflama ne be fa
he
inti eno ani asthma no types and doors but concept na edinya na say the equals within tubes pepe just that in details no reactions or what reactions no be hu so ya kakra wo but send you presenting the same thing
na ye funny say obey de hu say ade ye we asthma ana wawo akwala waba de bibi wo ho a insancheni bibi wo ebeyi edi ebe catch so me be or asthma ana this say o did no hospital as a doctor I catch us akwala no asthma ana obehu is it clearly visible
there be me patch because asthma symptoms ni bebre na so ewo yare fufuro ti edin say obetimi ahu say wa obetena ho say sometimes po no malaria no po enye yare bi say malaria no ya na enye right say wa betena fie say menya malaria because ubetimi anya symptoms bi say malaria but na even something associated with the heart inti wo de wo ho na ubenya symptoms bi say obi a wa start Yeboah asthma ne symptoms ni bi na ma start bi a wo akola bi na wo pani ni mpo wa start Yeboah
normal away
normal away ya wo boya afi wo hu say wo home ada no te wo branza na wo home wo ye adwuma kakra afi wo hu say wo te so afi wo home nso a eti dede wo any a friend reason home wa hasesi a obeti dede bebre wo obi won so an bosu timi ye ne ya pa onya severe chest pain Into start say who say normal way ya. The so we and say so ba hospital. Oba hospital afi doctor ne be take you history ni ye saa normal ya mabobo so bi obebusa saa symptoms bi obusa saa symptoms bi na wo a afi de betimi aboa doctor na ma ne hu kakra nso obebusa so wo busua mu no obi wo bi a asthma wo mu ana enye nkofo bebre na na omde ba so mabusua obi wo ha ebi nim obi on so beba no ebeboa doctor na hu say okay symptoms de directed towards and as a towards asthma symptoms. After so ye osan be your examination physical the friend physical examination doctor no e betie wo chest or the we be machine be beto to chest no so etie e de ahye na so mahwe what sound be no so betimi ambo ama na hu say eye e bia asthma na nipa na
asthma sound no ye is it yeah people find it
stethoscope yes
to asthma stay we na different
yes your chest and infections of course one problem of course your lungs you know ebia na pneumonia a sound
oh okay
yes your heart failure and pie your sound ayete you bet wo harawa ni mo lungs nim say ade we no a heart failure of one in so doors bebre ewo omo lungs nim malang enso ni bitimi kotai so doors wo body nim bitimi kotai lungs nim tie hu se enso na ekoso but asthma de no enye enso eye pipe a tubes nim na emu amia nti emframa na efamu no efamu with this kind of turbulent flow akwa say efamu with ahoden bi nti mi famu yi nti sa ahoden na efamu no e na ye tene sa reason no nti yetie a ubon se ubetimi apeke se bi nipa no o asthma na se enye no nko a enye na the right one na se enye the only way to diagnose it but the best way to diagnose the asthma nkasa apart from history ya je ho no ma ya busebusa questions no aye examination finding no your wade bi your test bi above so where from 5 years kwa and Colombia less than 5 years na you muntimi nyete because o muntimi follow instructions your test bi I friend of spirometry ne be boa me hu say ampa wo asthma ampa spirometry be ma machine bi ye be ka say because me ka say asthma no problem ne say from na uhu aba bonten no ana intimi mba ene problem ne kese de eba bonten ne intimi mba ti say uhu from na gu machine nim ne ya measure ye measure your normal range kire say wo de wu ni asthma but say o fall within sa asthma range o fall within a particular range e be hu say oh then it means there's obstruction be cause to your to enframana eba abonten no obstruction be cause one enframana eba abonten then the ebeye biem ni say now yes yetimi differentiate between asthma and ba ko dey friend COPD no because me ka say ni nyina yepe asthma ni COPD nyina da so yepe nti yamo ahome awie no eso atene ni ehu say obstruction bi wo so e tube ni na fe yama waduro bi eduro be bie o tube ni ti yama waduro ni e bie o tube na fe uhome wie na fe emframa ni yetimi nya ni na normal range dia na asthma me pacho say dem make no follow aha nti first of all what present symptoms when you have physical examination you show actually be say okay you dream say there's an obstruction e bi wo tubes in him which could be an asthma or a COPD now the be say you be your test near friend spirometry you be mo ahom egu machine bim uhumi gu machine ma normal patient that only any obstruction no your value be a
value okay
inti say uhumi na value near less than normal patient ne there na me who say there's an obstruction but obstruction no a normal mienu ne betimi de aba asthma and COPD inti yes afa ye pese differentiate between asthma and COPD ne ye sure say we dey asthma inti ye be ma waduro bi your friend bronchodilator ti ye bie u tubes na bi din the bronchus san your friend and a bronchioles and a bronchioles san your friend inti bronchodilator is a bie u tubes nim ti ye bie u tubes nim a na utimi home ni enya normal range na den asthma but say no medro no na mbie u tube no ma na den COPD no nti na meka say asthma no attack ne ba ne ma waduro a ye ma waduro itimi bie u tube ni ma wo hoto but COPD no irreversible.
And no the intimi.
Yes. Inti when you quite a befa so a bit me they diagnose any person or asthma, especially be or after or about 5 years. But akola well less than 5 years. No, won't mean follow instructions. Inti symptoms na me bubo any bi no. Any examination fine. Na say you tie ne koko no so a sounds ayete no. E wo so no na boa mai itimi mai ye diagnose asthma no. E won kola ni.
It was for still life on OK 101.7 FM and ye kasa for asthma ho e here some say ye count asam ntinene yatun suffer Dr. Kumi Yeboah Prince number boy na inchechemu na manfo nti ase pa along the line e be activate the phone lines no. If you have ever had any distress, if you have ever had any problem, if you have ever had any issues with asthma, hope share. We can also take that one when we activate the phone lines now. We'll be to me at shower drain so afaho and no. But dog,
yes,
share symptoms the bay. And no na me bisa say this so types no so boy no crap which say e bi wo hide be wo.
Yes,
obi so ya found. Obi so wa ko peke e wa adwuma mu. Say that was occupational
Yes.
And see how do we move? I just want to know that we are all not safe.
Yes. So issue when say what start say we just symptoms we are. That's all about hospital. In the hospital no so from your history now the baba you be say we occupational, we allergic, we saying. What then after that no doctor ni be hu say ni obe manage and I say obe start starting the treatment also it is em fan say be occupational there then we adwuma
say adwuma no obejai
yes we adwuma mu on ye be advice say adwuma no obejai and I say adwuma no at least you betimi apay adwuma foforo bia because ye nkwa hunya echen bibia because adwuma mu ho na wunya sa symptoms na dia and then also be pick from nsem na patient in a catch on. Yes, and you other ones and so on. Into what bad doctor show we or show we or no I can say be this particular asthma. After even no Baba started treatment.
So even treatments require depending on the type of asthma you have, no. And they trust the managing normal.
Yes. Treatment no it will be to say occupational one you say no. Oba ABA usually no omo asthma for no be brain say because of so your bad seeking behavior in the health system no so a problem obi obenya sa symptoms when you don't fam
on to cry
nti bebre na be with attack and I say in the acute form obeba no brands and obe hono nti obeba na ne beba emergency and all the forms and all the types of asthma no so betimi aba in the form of emergency ti near the aba the bad ye be say ye be boa ye be stabilize ye stabilize nature say ye be boa ma home na timi ayi by say ye be ma induro bi ye be ma induro bi a ebi mu ye de fa stabilizer mu na ma ye machine bi be si wo no ahome bi na timi abie o tubes ni ebie o tubes ni mu wi a na afa wi okay wi a then na afa doctor ba na ye no abekasa na afa ye hu the type of asthma ko e how because asthma types ni na dey the same emergency na beba ti afa wo ba ye problem ye here na say di kan ma we okay after that na no abekasa no kasa wi a na afa the say ye ji wo ho bi e bem ye hu say this is a type of asthma bia no na agi nti afa ye ji wi a na afa ye hu say okay say ni ye ba be manage you ti management and your chronic management of asthma and your acute in there me kan ye no obi the attack number ese will stabilize no because once stabilize na obetimi move from sa state no to a state a friend status asthmaticus and no say or the attack ne basa na ye twentwen so ni anya ebetimi adu state bi nipa no krampo out of home ye no ubon say ne skin ubon say na no ne finger no start here blue I started here blue because there's a lot of carbon because we breathe out carbon dioxide. There's a lot of carbon dioxide then body.
Body no. Into me
after you be signs of distress. It means that a do state I am where o crabit me free answer. To ba our main concern is to treat the acute phase. Now what we are then we can now pick up what is the problem a ɛkɔ so ne yɛbusa wo nsɛmbisa bi ama yɛhu sɛ okay this is the type of asthma bi awɔ then from there ne yɛde wato chronic management so nti yɛhwɛ a chronic management no nso yɛwɔ ɛkwan a yɛfa so ɛnɛ no yɛfrɛ brɔf kasa mebɛka sɛ multifaceted approach means sɛ ɛnyɛ yɛn nko a patient no nso bɛboa yɛn ɛnyɛ healthcare foɔ no nko a patient no bɛboa yɛn.
Dog, answer na backup management no was mami bo me commercials na yen to aso. It was a for jumedie di mami kan chom say special eyes mineral water so ye munedi jumedie bremo de bia asema ye kan ye ka asma asem kam ye sure say blue treatment doctor bebo nsuo asem so na ye see water is life into bia no nsuo one no nsuo cry say nye 4 sachets of water which is equivalent to 2000 ml of water and no show mudo no tentia also the big one now the account but at least one nsuo cry na 4 sachets of water every day and yet dakope is every day sounds nedi asida pa HF grills and so say at nedi jumedi brem kai say HF grills omoa ewo omo farms and omoa enenyen omonam omo akoko chicken omo krokoko turkey omo rabbit adanko omo quail omo snail and omo catfish me pacho open the fresh obenya the fresh ti say dey ene omo ko deliver ma de ama no fresh you so the be ya benkwan nti ko deliver the fresh ema no sounds na open the grill and so me pacho omunam ni nyina grilled or fresh on be ma grilled one no but obetimi from 0277 604858 0277 604858 fresh or grilled no so rare won say yes we Ghana nama ya grill pa uti ginger akakadro pepper surisa fomwisa garlic no oti we dia bani nyina wo oti say yes we Ghana nama ya grill ama wankasa ni nyina ewo mu bi enti betumi from and a weekend no stress member on cry and I'm the bar pack go for you nkwan you and on say we atutum it's a fresh of girls for 0277 604858 0277 604858 HF girls for a number no sounds na di aseda pa Nado's bakery Nado's bakery for was so tum Ofanko road no so Capital Hills Junction nimu omu no mu brodo bunsem brodo no ntumi mfa nsa ba kunkukuru emu yedu very heavy bread within so a bread ni de come taste the best of our sugar bread, our butter bread and our wheat bread. Nado's bakery for I don't know me pacho almost all the beer the be mom bia omo fa bibia could be 1,000 2,000 10,000 whatever order you have on bejini nyinama what the 10 so ba on be ma what the 5 about some I mean they take any amount of orders in the much quantity beer and there are no limitations but omoka just said they deliver also on time we hear order na onion we arrangements na delivery normal same bread same taste sugar bread wood has a wood cake omo ho no but your number is near 0244 836155 0244 836155 and 054 054 16 81765 054 16 81765 omunya so ya sene edjumedi ebro ento betumi afre Nados ewo numbers no so 0244 836155 and 054 16 81765 kai so mo so tum Ofanko road Capital Hills Junction no more sugar bread butter bread dia opebia no limitation when it comes to quantity on bayamo me pa so mututon enti o pese uton bread and so obetumi afrom omo de bebro na was what on no nya kakra kakra now so what your what dear and no ye do mun nyina ase someone so ya se na di dwumedie ibam sounds na me da se da pa this way chocolate drink this way so ya say na di dwumedie ibam this way chocolate drink obetumi afrom 0 0 this way chocolate drink obetumi ayawo dear no an say waje wo insio na why say weather no won say that weather na ye no and answer waje wo this way no when you insio share no a steli koroma for kai o steli ya na why o sandwich bi na the account and e ka balance diet e no balance o diet na mama why ai when you this way na when you dan the long kakra nkosi anua ba kubi aha we try on toast ni jene bi na the afra na why sandwich wow dear na odi this way na boso and say no as when you this way na one now Nando's bread no what it dan the long one dan chi one young kusi aba kubi ato so 3 cedi ajan toast ni jene bi eguso what balance o diet na no only obia eni asem mama go back to the studios na me the Dr. Kumi Yeboah Prince and Kotsua Nkomana Yeboah. Meanwhile, I've activated the phone lines 030 224 3547 030 224 and now alternatively over to me after 059 62 902 059 62 902 obet me after any of the numbers na dog so ha we amwa makes me ama one e ama it makes me a director on so na director into 030 224 3547 030 224 3547 mo share live on our Facebook page and also we are live on our Facebook page and see you can also join us let me do messages and so at our Facebook page and also you be reading in now so so we are live on our Facebook page. You can also join us live on our Facebook page and we'll answer all your questions for you. Meanwhile, you can call us on 030 224 3547 030 224 3547 and now alternatively 0596 200 902. Mami back to the studio na minute dog and Kobonko. Okay, I'll be able line us into Mami line. Hello Mohoyana. Hello Mohoyana. Sorry. Okay. My virtual lines are activated is 030 224 3547 030 224 3547. And now you can for asthma. Have you ever had an attack? Any of your family members have an attack? Do you want to share a story? Do you want to know how to manage yours? Is a discussion for the day. Madam for normal frame, I think Doug has mentioned the problem, no. But I would like us to talk more about that and see how best we can also help him that way. Hello, Mohoyana.
Yeah, who you Auntie Abigail? Good afternoon.
Good afternoon. Pacho, do you need to be free? Oh. Bibi aboko. A brief one way. Adom ashe ni takashi kakra. Me chow na umbeto me book ni binti se when I me chow. Me vegetable.
Oh, okay. Then I will come by.
Me veggies so na some by.
It will come. Last week, I I was even at Peter Center there. But the truth is that I didn't update you. So I'm able to just update. Some few from some few cucumbers and then spring onions and then what do we call it? Mint.
My favorites.
Yeah, so I'll plan one day and I'll bring you some. I still have cucumber and then mint that I'm harvesting and spring onions.
Me pacho menche be brewai.
I'll find a day.
Mint no blend any cucumber na the taste is different. It's something
Yeah. I even have one.
It's something
there.
Else.
If you add it with the mint and you blend, it is very nice.
It's very nice. Now I'm on a kick of lime and a lemon kakra.
Good.
Good. You be on another level.
When I'm coming back, I'll get lamb from there because they have a lot.
Okay. Martin.
So it would have been better we just add it once and bring it to you.
Doctor, it's you.
Okay, I want to ask Doctor, not about acute. I want to understand the acute very well.
Okay.
For example, when I try checking everything and I check what do we call it, hepatitis B, and they tell me it is acute. That's what they told me. They said it's acute.
Acute. So you want
because
to understand the word acute.
I told them to go and let me know the viral load. How has it reached? And they said they checked and they said no, that one is acute. It is a normal thing. Maybe taking paracetamol. If I'm drinking, I should stop. I don't drink. So they told me those things, but it has been very, very long. It has been more than 6 good years. I went back to check the liver, kidney function, everything, and everything is normal. So I want the doctor to explain that acute thing.
The word acute.
Yes, the acute doesn't mean you still have it or you need to fight to let it go or it will go naturally, because that's what the doctor told me, that one it can easily go without you drinking a lot of drugs. So if he can also explain that one to me, I'll be very excited. Thank you very much.
Remember now explain. Dog,
okay.
Obi say, you can say the word acute. What is acute and what is chronic?
You bet me using in context, baby, especially with Canadian now working with hepatitis B, you know. And I say hepatitis, your acute form and your chronic form. Usually, I can say, be acute. You bet me often in the context of period now the corner AC no, and I say you are base no. Medically, you can say you are be acute. Usually, I know less than 6 months.
No, okay, not just in chair.
Yes, now and check within 6 months. One case our body bet me a fight. You are really free ho. And to tell you now work no. Doctor no share no who say we are ready ebia liver or kidney ni be no okay, but just that to hepatitis screening no and you who say ebia
dog give us so obi aba no something mama me fa we na yen to aso. Hello mo ho ya na. Sorry bacho di ni baby akase free.
Yes, I mean I'm president of committee.
Okay, and some bacho doctor too.
Me bacho wo me say doctor.
Oh, sorry. Okasa got me so Yeboah. Until my patches obey me afraid back and kebe the pa na doctor Mboa ewo hono. And see dog into acute.
Into acute no aba within 6 months now our system are fighting at the free.
Okay, so the doctors knows that within 6 months the body can fight it off.
Yes,
okay,
yes.
That's why
sometimes we depend because you some Arabian ones so hepatitis beer. A be or why background BB hepatitis C for instance. A bar usually no majority of them moving from acute stage to the chronic stage. That's ultimately you one for more than 6 months. At that point they do chronic state. No. And what types we say A and E. And sometimes the B, majority of the hepatitis B in the crampono. Within 6 months, and one cause our body to me fight it. A few system. And your friend acute.
Okay. And if I'm understanding well, not just said doctor CBB acute, not just then who within 6 months.
Yes.
And chair yes.
Yes.
And chair
yes. And chair.
And body.
Yes.
Because of the test they've done. No.
Yes.
When them say way and maybe be able to me a body. No.
Yes.
And so within 6 months the body can just clear it off.
Yes. Anna. Yes. Anna, you bet me use acute also in the context of treatment. Yeah, Anna make one thing. You can say acute something. I say ode. You find say obi wo heart failure. Your chronic management of heart failure. Chronic management say afebo na enipa no obede aduro so anase ye be treat no. And you acute form say we dey attack na ba. Wo heart failure no starting your symptoms are e dey wato distress mu.
Okay.
Sa treatment ni ye dey be ma on animu ya. Nti the word acute na e betimi using so many contexts.
Okay.
But in general no as animu ya.
Me pa show you. Ma me fa call we na nto. Hello mo ya na.
Antiama na baby.
You antiama we ma me nto bo we dey kasa why pa show.
Me pa chomp doctor. Ma bo was afraid. My me love to test with me. So na me da si bo July me bo was say.
if I understood it was what was I test a bibia basila and one not that so ho. Into a chronic one day.
So cough no, the case cough or case what was doesn't come my period.
A boy by me say no clear.
Okay, nti go to me my period because cough no normal baby bit me cough cough. Heart issues bit me cause cough, or heart failure cause o cough more. Now or lung problems are basically most of the coughs are from the lung problems. Even or GIT problems we to say a fresh condition me gastroesophageal reflux disease. I say acid or yem need to me boba o bosoha. A boba o bosoha bones na a start ya ma o cough inti cough na dey bebre na bit me see but yes you period no. Na fe test kono ka say yeah no say who test because chronic cough there baby to say yeah dream be tuberculosis heart failure sometimes your other lung conditions be or a presenters are into I just say me who test and I see who test why and sana ana sometimes you know on cough near say reactions they cause your lungs in him and while body mechanism is trying to bring and I say trying to take those reactions out of one kasa lungs nim na dia ba bonten nti do obi betimi anya pneumonia betimi treat no pneumonia ne beko but we won't still cough no cry na so kakra because they are still residuals of ade na ekọ so ho na say o cough mechanism and I say o system na o body ni me say etimi yi sa normal pie nti esi ehu the period that all coffee ni ehu tester all ye then a doctors na catch them about it.
Na it's me at the crop say maybe they have to do another lab maybe after the doctors need investigate it.
Yes maybe after no master investigation
and also one more it was for still life on OK 101.7 FM kai say ne ya kasa afa asthma ho into showa right okay hello mo hoya na oh auntie ama sorry oh facha me
Doctor, one for 8 years.
8 years.
Me patwai. Me mama diana. Maybe I met Sano and Sama war. Every Tabaco below Casse or General also to say asthma. To say your kind, Mamma Roma direct lamp on not the way you see me. Akoko, no tea woman, no Casse or no suspected asthma. If your mommy, no one here like come. Your name in the Highland may use.
Yeah, the way you
me patwai.
Oh, ma.
And I said, before one hour sat here, may hear mamma is bear 1 month to come and hear mamma. The fear, Miss Esther, mamma in Kwana me.
The man, but you was not hospital, you.
Yes, you are me. Me want me doctor baby am here. My history, my of course for the even at all the by me call one hospital. I'm call and jam me say. I told me after one it me catch was almost a miracle say. Ya be na me dey ba one mo quarantine no. Almost a doctor say mommy bro me dey men see am in this food brain. Doctors need be on normal shower. Who beside the question?
None the wolf.
Can be one open search to and the wolf. Also, they are mature. Do Coco Genako. Mako General, Mako Polyclinic, Mako Krista, Mako to be brave. Oh, what could be a way? Every GIP, me boa.
Sammy. Fantiama number why? Antiama, me producer na phone number. Obe fraud. Why? You be fraud. You be share. You need your doctors back as an ashamba. Why? But dog, then the best me a cause sir.
So like I say, chronic cough ne dey normal be bit me a cause. But issue is say yentimi busy wo cough ne nko
yeah, there could be environmental factor.
Yes, and
okasa na be see me stream.
And normal be nti I say doctor bin so ne tenase.
And no so obisa questions na doctors dey buofu no.
Ese because say e bia infitiase no obviously any panic dream say a asthma and I reach a bit my asthma e be uncle fine healer and impa uncle be okay but all these one think I asthma and so na me dream one care the uncle the attacks ebe ko hospital will be brain yes nti just the cough and inquiry mint na so I need to probe him further na me who say oh e bia with cough no me busa ada normal de me kire bia heart failure me busa normal ada normal bia de me kire bia lung disease bit bia lung cancer TB and all this kind of chronic you can say line aha nti just the cough mint me advice am de be man is so who say we try those hospitals no anye we ya onko at least ontimi nko any other hospital na me who say the doctors ne be catch them no ondi so yes at least they odi so na uti na bia ofani ndro na say no kan ya man ndro wanfa e bia no mu man ade ndro so no so onfa
okay
aha esa so akof na enko
on ba share raincoat no motel I was our first live on OK 101.7 FM and I kasa for asthma I bonne papa na dog unse na me ye intro no maka just madam for bia ne ba aware 24 years so wanya asthma da nkala bre oni bi afi na waware omukọ honeymoon and I don't want to say lucky or fortunately for him no omutu kwan ekọ ebrochire that's why they were going to have their honeymoon for like 2 weeks or so girl ne bra bre guy nenya asthma you see when you asthma like for no reason and I now work as the adults but what could make it what could cause it so be wie after when you asthma at that age
so unse fa a topic one na make na no genetics in collaborate na obenya but usually adulthood asthma no ya na their friend irritants and normal way around here ho ana induce reactions ewo and I say cause inflammation ewo tubes ni nti ameka say mpenifo de ya na edin because ya na nye nipa no ni any family history of a atopic problem and I say be allergic issue be at least enkola ne de ubusa history 1 or 2 be ultimate nya a normal mpenifo ne de edin because ya na ye a normal wo ye ho a be a perfume bi paint bi e wo dan ho yes sa normal na yes anedeba aha nti the beba say si ana they are diagnosing na wie no treatment ne na ese ye ni etimi manage na onya attack because asthma ne de
na obuntu me nsama ne nko
dem patwe ni kio
sa
ye hian say obetwe ho free trigger no na afi treatment ne so aye de be ma no obeheso no ayi nti
we say trigger ne de aware no
de patwe de
because don't worry no nya asthma
ti no de
trigger ne de
e bia wa ben bibia like e bia or reactive to and I say ni airways near very sensitive to nti oben sa ade ni bia na afi a trigger sa reaction na afi cause sa airway narrowing no na e de problems we nyina ba nti na mpanifo de na because ese oba now we have to ask like more questions about normal be a fa de ye ohun we say we use we ohun we use we and I say be a we adwuma wo he just for us to even know your triggers I feel so esa won so boyen now also identify to say be a the time of the day I utanya attacks no him fa na wo kwa utanya attacks no yes then normal na wo sha na sometimes wo ade particular na say me na be adi yes
oh okay into some now odi dware to me trigger
yes you do management
no
yes you be who triggers ne wo because ofa na allergic and atopic ones na omo triggers ne yes e be mo ene nam fie gina moa omo nam no
omo fair no
yes bibi to say mites like rodents and nam fie no ekura ehonam na ene nam cockroaches omo saliva ne ebi mo janan mo na janan nyina timi trigger sa no man yes inti na make us say asthma management and especially with the chronic management no a multifaceted because ubeboayen now you should be able to identify the triggers na wo no So that yes we bet me aboa with you.
Okay. So it's 03022435547. 03022435547. And now alternatively me pacho obetumi so afre 0596 200-902 and no to me assign a voice notes and now WhatsApp message befa and so I'm but me so assign afre was online also 0596 200-902 and no your alternative line but main line no 030-224-3547 Dr. Edaswa away in chain waha and net yakasafa asthma and then the bar hello Mohoyana. Hello Mohoyana.
Yeah, we are fine.
Yes, I don't. I should hear Nitakashika.
But now me will bath more baby. But now Osano. Now me pray. Now don't take us a week. Me far when you walk. Every hour move ya go to the fun war. Come near.
Yeah.
Na me proud to make you. If that come one of me who says, "Oh me, and I'm gonna call hospital." So me call on Monday. Be machine be tiane who so. The meaning machine so na. Me coming to. Kakra no mu free.
Omodi share ne hwene no onhome me boa.
But also.
Omodi share ne hwene no onhome.
Omudi si ne
hwene so ya.
Like
nebulizer. Okay.
Aha. And that no ye asthma na.
Oh. Na we then a doctor dey catch you.
But also.
Then a doctor dey catch you we no.
No, me stand say no mama me ndrona. Me dey coffee. But why be there 1 year come. I did not stand. That I know something. Number 1 year. Not
na somebody. It's a somebody. A somebody now. Hey, sister. I'm a friend how many times?
No,
man, yes.
No. Me pacho. Pepano. Me kwa trena. Because I didn't be no way. One answer, but I see
a baby one hour to draw the beam.
But I'll say
a baby one hour to draw the beam, but you're sudden many beam, pacho. Men, and to say, I deport say, Yakola, and win him.
But I'll say,
once I say, I deport say, Yakola, and win him. And one say, you to a drama, Akolano. And Zanka onya break a crack beside doctor and so Dr. Pachona den ne yakole Uncle Beck hatcho and so drone but your man father can in Zibium a who doctor no don't share no on one country say no what on now in every for an shaman or why
but so much inside
say to me say asthma and asthma because me know you mean I mean
yes,
and at the whole columns to me interested because it's me be for so. I bet me I ask me, bet me I COPD. Say that doctor can not be before from
COPD in Podia. Na
as I say. And see some hospital na doctor and share no make sure say no here pa why? I saw how collide that chia collide baby saw that you.
But also,
Miss one go check now how collide that chia collide baby saw because send mama na ye. Bye bye. Dog bacha tata.
Nti another question is no. It could be say be a freba could be bronchiolitis. Presented to say asthma pepe but usually I don't call under be 2 years na tanya. The ba best asthma into a bar na ye the address you so ye the show hunim na call no ho atono. Usually I have virus.
And now some open airways no. And different.
Bronchiolitis, yes, a donor open airways because bronchiolitis is not to say a presenting asthma and pepe and also man sa bronchodilator na it may be airways no book but I don't know a virus na cause instead of say asthma no normal bit is yeah triggers allergens allergen irritants and of course but they are na viral quantity bit me aba say e bia na yes bronchiolitis so e bit me so aba say asthma but onyi no ana wenyi afrim because me kai say me can earlier on say kolade bi o hwa e start o ye bit me diagnose as asthma but onyi no asthma ne crampo eja era but na esen koma doctor ne che which I feel say obi akọ hospital na odi yare bi kwa doctor ne kan yare di ni kire wa ma ni kire omu to the point a wan kasa wo beti yare na se na afen so sa attitude say ma kọ hospital ya ma meduro asan me amede until say doctor na ka say san until say doctor na ka say san wa akọ ko tobi dear one kasa dia bra hospital ho bi because yare bi o ha onu medron do some stage we ba na ye hwe ne say yare ne so atia e reduce the dose of adrenal crama but we should also bear in mind say do be a fa bi an so side
effects okay hey 0302243547 and their phone lines are used to 0302243547 and now alternatively obey to me after 0596200902 and obey to me I send a WhatsApp message voice notes and now obey to me after line no you be answer ni na Dr. Kumi Yeboah Prince medical officer ewaha it was ya kasa for asthma ho e den and I was unim efa ho Hello. 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 Wait, I'm picking. Hello. All right, sorry. Hello, Mohoyana. Hello, Mohoyana. Hello. Me ba cho dini baby akase free. Ba cho see for set from Kaswa. Okay, set you. Set you. Sorry. Okay, over to my friend is 0302243547. 0302243547. Can you put this on for me? No, this one is on. 0302243547 and now 0596200902 lines near activated. Dog, yeah, share triggers no. Yes. Yeah, we are now share management na kakra. Because there was time, you bet me at discussing in now because the asthma dear pa and it's just unfortunate to say madam for you when you be at the age of 24 I feel now our crown need any yen to mean that but he has to manage it.
Yes.
Wow and they know also on finding the triggers no
and no sa no oba you know bekasa nti ni nyina aka treatment plan chronic management nti ofa chronic management na yewo first of all say you be identify first of all say anase the di anim first ye hwehwe triggers no e dey ba no nti eno so ejina the type of asthma ne so nti ofa a bit say atopic anase allergic asthma na na me boy say more mo nenam fie pillows even carpet say form dear near the carpet and pillow who normal sa normal ni nyina ti trigger e mass nti up to my men say oba identify say me be me de to ha anasa abo we ba ne nchen na attack na ba ti oba ho ne yebusa wa na afi wo ka kire ya na yenso yehu de yenso ye be ya fam ida sa abo ano wo betu anasa wo be sesa akwala no e normal bi wo ho then wo yenso ani aba non allergic ones no non-allergic ones no and make us usually are irritants and normal irritating and bit say perfume ofa bibi to say gases be a better paint be out there painted down ho sa normal ni nyina itime trigger reactions no airways nim and I say with tubes nim ema sa o start to obenya sa asthma symptoms no and e bin so the exercise medical so exercise induced asthma. They say exercise there. Exercise jaye anateso. And there are some particular exercise be or what. So be pia bonti back exercise in the cold weather and I say whether be or she will be brew.
Okay,
yes.
Okay.
And also in a bimuso the a bimuso trigger no. Especially which is very common virus. Especially during the flu season, you know. Flu season when a bimu started so munya attack pa ye. Inti say ni pass around esi ma flu shot ni bi. Every year be because flu virus and every year be
but okay flu shots and no broche na ma flu shots so I ma flu shots so o ye ejuma wa Ghana da be na won say ma flu shots for Ghana
see at least also because a very common virus
be wa Ghana there ye ma flu shots oh okay
nti ese what's happening ni na especially so say we asthma because virus bit me trigger start attack no and your back could be your friend aspirin induced asthma nti management ni hu nyina manyina na bo no so omo mutai fa kofu bi omo fa painkillers bisa aspirin diclofenac money sa painkillers na ebi nso itimi induce sa asthmatic attacks ti no say bad advice o say ubetwe ho afri ho nti triggers ni nti doctor ultimate identify triggers na me advice you educate on so ubetwe ho afri triggers
nti who identify triggers ni it makes the treatment simple for
yes
both you and the doctor
yes because eno na ebe initiate the whole process of sa asthmatic attack nti watwe ho afri ho a and as ye ho afri ho a sa insunsanso ni nyina mba ye free trigger na afi yaba enduro edema nti enduro so yede be ma wo se wo ba wo the acute attack ne ba wo me no say ye stabilize wo we stable we a na afi ya share the severity of senior attack ne tie in a week how many times na unya nti eno de ye be wura de friend no ya chichim ye friend ba ko mild persistent sorry ye friend no first one started with mild intermittent and your friend mild persistent and your moderate persistent and your severe persistent inti offer mild intermittent na within a week round bear one bi no wenya attack bi eno ye wo eduru de ma inhaler no ube inhaler ni nyina ye de ma obia but esro bia ni eduru ewom
okay yes,
but as
it means that the same color and so the woman is different.
Yes, the different because asthma and donor doors and your dear friend bronchodilators I be sa tubes in him and your dear friend abuse steroids, corticosteroids and on a preventing inflammation and caution. In syncophobia dear why is so severe says you're combining immune. Into any advice I will say
obey you so be
inhaler yes. This is the reason TNA advisor will be here. Into for mild intermittent, just from the word intermittent. One be now. Yes, and we were to do a demand. No do not know in shed and yet to say. Abia the next one mild persistent. It is persistent, but a mild. Into your fan is Abia within the week when you be 2 to 3 times be attack be. But what to me with daily activities. And your moderate persistent within the week when you bear 6. After your activities important to me yet and you severe no na ba enipa na kasa mpontimi nkasa ontimi mpombi ma umbo say ne ho meni yen tentem ebi mu krampo eye confuse nti saa no onum nyina ye ho adura yede be ma won nti inhela na yede be ma won ebia ne we wom edure wom ana even severe for no krampo nso say that severe steroids no usually are an inhaled one and as corticosteroids are an inhaled one but that severe you ma oral steroids oral one the obenuma fa wonu man kasi you say very very severe into sana asthma so the treatment and treatment is basically based on severity no say your asthma ni severe tie
okay doctor
apart from that so you will be a friend no asthma action plan ninye say na yes yama Oduro we nyina awie no yama o paper bi paper no your code was your green code your yellow code and your red code green code no o hwe green code ne portion na obi a oni say ebi a uni sem ebi a wofa wundro all right ana symptoms bi emba ti say wofa wundro ana symptoms bi emba de a wo green code inside ho but ebi a wofa wundro all right but utimi hu symptoms say ho me e wo bre oboya o yakakra o yellow code ho ti ho nso ya true treatment bi o ho in case say wo start say we experience say de na obefa ka wa wundro na wonom ne ho and your red code ni say just like red danger ho de ndro na ye de ma wona nkasa mpo no in a brand say netimi ama ho ato ti sa ankofo ne sa no wo sa range ma mo na ebi aso ya kwala a wo se ohome a ne kon ha sei no ye fra bibi retraction na wo se ne kon yes e ko inside na e ba inside aha saa no ma ni nyina na ma ne ye severe na bi mu nso bo se bi mu nso omo ne o se ya blue ebi mo brands no mbe home omo obi e friend is flaring saa no ma ni nyina wo enu ye very severe tie no wo saa red code mi tie no ba hu a straight ambulance na say wo friend you have to call the ambulance inti no na bi a 911 no afre na say ambulance service na ba be na wa ba hospital then na yetimi aso ano ansa na the wura sa state na me can say status asthmaticus no because no the one way a edu wura sa state wa agisa ICU na yes obakopio ho
ebusa for still life on OK101.7 FM kai say na kasafa asthma ho de ba dia o say we ye and ahwe so I was say we obi ask any questions. I don't think this question is part of what we are discussing today. Emmanuel, we are not talking about the male reproductive system today, so I believe so the next time we talk about it I'll ask your question for you now. Maybe and I see your intene yakasa for asthma. Let's concentrate on what we are discussing. I beg you. Okay, and then yakasa for asthma ho. And see any questions relating to asthma, anyone who wants to share experience on asthma with us, how you want to trying to manage it for years and so and Upa said Dr. Boa was so and no more any discussing. So the phone lines are activated 0302243547 0302243547 and now say alternatively but me send WhatsApp text message voice notes I call 0596 200 902 0596 200 902 ofra and now send a message and now send a voice note ya be born in ama Dr. Eda so our studio Dr. Kumi Yeboah Prince medical officer ono na ene bon komo ene afa asthma ene no was student dog na dog when say wo kasa nyina wo ka say trigger ne beba twice in a week and we then a back e call mama ne ho or see every year she experience this cough that she's coughing. It's needed maybe it's not even in relation to it.
On say asthma any cough pen.
Yes.
Intina make say nedia no. I say now can she anye complete my yes. And asthma attack and so ba obi be cough but then a normal be break home. You find it very difficult to breathe.
Yeah.
Yes. Wa home e be yedin. Ubenya chest pain. Sa normal way nyina wo yes. Okay. And I mean, sure say asthmatic attack because nanka going through all these attack on hospital. Obviously, Nabusia for crowd in the hospital. Yes, I don't think they asthma. It could be from any other lung problem. It may be TB and ACBB present with chronic cough.
We actually don't know. Because we haven't diagnosed it.
Yes,
but this is just speculations, but sure. Yeah. I'm just telling her the more Sienna. One can say yes. It was for still live on OK101.7 FM. My Dandy Abigail Ashley being produced by Sammy Otavio. Big Flesh executive producer Dr. Father Dexon. Nados Bakery and Damase and I'm a brother a Oduro a sign de. Aye, yedamase. But one those bakery was sold to Ofanko Road, Capital Hills Junction. No more, almost from no matter the quantity you want. On Baba deliver 0244 836155 0244 0836155 and 0541681765. Upebi aton so a the same number on Bejo. I am here more clients into bar. Say 5 or say 10 or say 20 na episode tone. We no country your best sign. Na your market support the bebro. Baby I want. All you have to do is to call the number and they will deliver it to you. Baby I will be here. Dog, yeah, share triggers.
Yes.
Management.
When you management.
Management okay. And the into also.
Management is say triggers ya ba be medications I dey ma based on in severity no. And I feel so ya ba be maka asthma action plan no. Say who fi kwa na who fa Oduro na bia who what this particular range wo yellow or green and I say yellow ma green ni kire say wo de wo fa Oduro unye nya any symptoms bi aye wo fa Oduro kama yellow ni kire say what who fa Oduro but then what symptoms
yellow means get ready.
Yeah. Then red there it means they cry they off yes into no red in there say your ration near the hospital them near start to say hospital now be treat you na say Oduro nimpo na enye ya e be aka na say e best son. Then after that to lifestyle
lifestyle
yes smoking so we will be aware asthma say o twi hu free smoking ho baby e wusi because
na ya menti asio akwala ya wono onu munsa da onye hwe smoke mo be bosom dey risk factors na mo dey smoking na start akwala on smoking that so asthma
say on say or asthma no all right and smoking no smoke no containing toxic substance bi o betimi enso betimi initiate inflammation e wo nipa no tubes nim so no a ono ni tubes nim o bre or the dose no de home na wa say exposing to so it be an nebusuani bi ana ne maame bi ne papa bi e bi anum bibi sa ana so wo ba bi mpo an wusie bebre smoking not say e be a smoke free cigarette mo all the time but even normal smoke you crap bit me trigger bibi sa
okay
ana say you did nso ye ko you did ye boa my immune system no it means so e fight sa normal way bi my ana afin so exercise say exercise induced asthma we bit me exercise ye because we exercise so or lungs any wakoma no all the time no e mani nya ahoden e mani timi ye normal bebre na afin so the here men say hospital na ye ka inhaler na say ye kire mo say na use inhaler na but omu enya ye like omu ti ase say na use no because obi o ha bad technique nti de bi akwala no and say nipa no attack mo ontimi use inhaler ni
on benefit from it
yes ontimi use inhaler ni nti we ni normal kakra
okay so no patients asthma patients use each other's inhaler
Debbie
and so watch your cry untumi use so be
Debbie me pacho the here say ya foul na say in case attack ne ba that is why to say inhalers ne normal ne dey say woman is free ho esa no aba hospital doctor chop prescription ama na say hu say ba be san no aba hospital doctor chop prescription ama no akwa kwajibi because say ade e ka akwala no ho and say ade e ka nipa no ho to woman free nipa ne nchen a e de nsunsan so bebre ne beba e bia nyame mpengu na wantimi endu hospital yes say oba ba jibi tie no de e say ka akwala no ho and say
every day
nipa yes every day
now asthma patients beyond so na using inhaler
so the any on say send ye ka say obi o ha e betimi starting on inhaler so but with inhaler no for some time no onye any attack there are days in on use inhaler no ni a monitor for some time onye any attack bia say any pan e betimi ama no eja inhaler no na ya monitor say if there will be bibi saa wo a ana say ade no sounds betimi ababi ana so betimi nya saa attack ni bi ma ti me ka say nyo obi ya asthma patient bi ana that them inhaler but majority of them ne dey majority of them they inhale now because unyanya attack now ese we okay and sakra na be necessary see do aba hospital omodo beba.
So live on OK 101.7 FM and I kasafa asthma Dr. Kumi Yeboah Prince medical officer nene bonkomo. I can still squeeze some 2 more calls. We'll fry a befa one Francois Yebechum 0302243547 0302243547 and now alternatively me pacho over to me afraid 0596 200 902 0596 200 902 030 224 3547 030 224 3547 over to me afraid line until fra Dr. Ewaha Emma 030-224-3547 030-224-3547. Alternatively, you can call the 0596-200-902. Dr. Ewaha and the ear can asthma. Into na dog into show any asthma no anyway sometimes the 3 words na say moja broso say moja na broso
we cry research part of me answer na me hu twi ni bi.
I don't know how in the into show I came to be with asthma, but anyway na into show bibi show wakoma na bibi anyway that's just by the way. And see dog get share if it's a lifestyle management, no. Boy, there was so with Gianni D. Is it necessary? You have to take care of your food,
yes,
your fluids, and also count that does those things play a role?
Yes, because asthma the chronic dehydration. Because dehydration itself can be a trigger amount. It is a asthma but all the time, you know. When you be all the time, when we are dehydrated, the bit me initiative be a complex process be all tubes in ama inflammation. So no money in a bit me see am was sounds when
you be on no man was so sipping you.
At least the so we are hydrated. At least in so the so febi. Aduane no so all because ese ultimately because when you have that balanced diet and to even build your immune system. Because the aduane crampo even affects our immune system. Yes, and even the aduane no so crampo no in the year. There are some other conditions so a bit in the amount. First of all, because you are battling with adiwe. What sounds to be any other condition? Or system na crab bread.
But are there foods asthma patients in the? I know mudi bibia.
Oh,
because when you come to friend is saying diabetics, they are strict on their diet. Asthma, are they also strict? Not really.
Not really. Me who say asthma patient then say we deal with that. I didn't hear any trigger no. Say trigger na eduane bi na say we di na mouse problem ne dia. And you better say jai. And until then you can eat whatever
anything.
You want.
Okay. And I won't you so no.
Yes.
So they be also sip.
Yes. They say we dehydration. There's all true feel crap.
And essence to come. And sense to come down.
Be crowd.
Hey. As I'm not say. Oh, and the dog in patrol. Yeah, sorry, sir. Then I'll be so catch Ghana for.
Me chia Ghana for you na me chia wetie for you na so. Na me catch Ghana for say obi make it time na every Saturday be onya time no metie show we bi. Na afin so asthma Ghana asthma kunko for pa. I think that if I'm right, every year be a bank of 2,000 out of asthma. Inti area a bar a better now one febo and collide the start here. If you move put to me omuni it me but penny dear a yana untimi in free and ya Arabia but in you sa the obey yana say obani a show ne asthma na undry do better sono no benum. It me identify or trigger and I say do say inhaler the be man who be use it me identify trigger and so trigger and watching where free I feel so and no maybe a be my immune system about form and I say be more additional problems there alcohol any smoking this animal will be a bit train where free with nyankopon and so can we ya win apomuden beba nti we dey mpache we na make catch Ghana for
yeah that say miss mejira Ghana for anemu eni metiefo ni mahwefo anemu na dey aseda kese pa ama minim say na ewie le na why busy pa na wo baby ko nanso ye hu donti udi hu abesi ho amaye ye hu donti udi hu abesi ho na watu yefo wache ndi wo say ye eba no asthma ene yapomudin ho de wo say di de eni say yedi de wo say ye ene de eni say nyina watu yefo e wo sa akwanya ni nyina mu enti ebeda wase Dr. Kumi Yeboah Prince medical officer yene ne bonkomo efa asthma ye beda wase pa any time why dog
Pacho Martin so madam ase uni team for nyina
mate na menshra oso
Martin Pacho ye be hia bi
amen ebusia ye di ene de no besi ha ene ye kasafa asthma ho ai eden ena edi asthma ba how to manage it ye ka the types no your occupational asthma crow and penamete na me say de bia esua de into de bia so na de bi ahya okotodwem and ya point me san say kwa kosiesie ho ye kokend that the lumba vigil into bia ye kwa kosiesie ho ye ne de vigil de so bia ye bi woni potem me say de me kwa ko ye me de wo me fio into we wo hwe na unto me by Independence Square because of traffic and now was what now vie now why o de me hu say pap ni nyina abeka junction obi ade lumba picture abobo ho omo ebuku DJ Flash nso buku no bebre so mbebo nti ene de ba kai search on bekwa sorry nti bibia obeyibia nyame show bibia obeyibia nyame show kakra kwati ase ye de ene de besi ha medamu nyina ase mpache benya lumba num bia bo bra ye siesie ho akone vigil nana ni nyum no kra de bebia me de oni sa akode nyum se obenya mamia ai we nya nso a na wabo efa ne sen ba ko na na mum me ka se ne spectator no emma me reho ye pa poor nutrition leading to cause of death and diseases. It is here. I'm sorry, so not me ko prepare me. You know, away.
You know what time it is. Come to be born ready. This one time for your mind, y'all. DL Young Pop now.
I want with you mean to me, my fioro. I do with you mean to me, my fioro.